This biopsy paper showed that Regeneten was completely indistinguishable from the local tendon and increased tendon thickness by 1.8 millimeters on average. The Camacho paper from 2022 was a biopsy paper, independent and prospective study, focusing on 30 patients who had rotator cuff tears, 18 that had full thickness and 12 that had partial thickness. Each patient got a Regeneten implant, and at 12 months they decided to do an MRI and 6 months do a biopsy. The biopsy showed that at 6 months the implant was completely reabsorbed and replaced by new tendon tissue. There was no inflammatory responses and no scar tissue formation. 27 out of the 30 patients that received Regeneten had complete tendon healing, and the other 10% had 50% of the defect or more filled in. On average, the patient's tendon was 1.8 millimeters thicker than it was before they had the surgery. The conclusion was that out of all 30 patients that received the biopsy, the Regeneten was indistinguishable and replaced by new tendon-like tissue. It had complete integration and no scar tissue or inflammatory responses, and increased the average thickness of each tendon by 1.84 millimeters. For the full paper, please click on the link below.